At our center, we use AlignRT to make sure the patient's set up in the proper position, not only before treatment, but throughout the entirety of the treatment. A typical course of radiation can last anywhere from 4 weeks to 6 weeks of daily treatment, so making sure that that patient's positioning is reproducible from day to day. Especially for our left-sided breast patients, we worry about the location of the heart in relationship to the left breast. So we use a technique called deep inspiration breath hold, where the patient takes a breath in, and by just taking a simple breath in, the heart moves away from the chest wall, away from the breast, allowing us to safely treat the breast with minimizing radiation dose to the heart. So using surface-guided radiation therapy with the AlignRT system, we can ensure that the patient's breath hold is the same day to day, so we feel comfortable as clinicians that we're appropriately treating the target that's intended.
A couple of ways that AlignRT can help patient treatment time is easier and faster setup. Once our therapists who administer radiation get used to the system, they can actually line patients up even faster than using lasers and marks. It also reduces the time spent getting that patient in subsequent positions. What AlignRT does is speeds that whole process up so that patients have very little time on the table, which is our goal, is we want to get that patient into the hospital, get them treated, and get them back to living their normal lives as quickly as possible.
We have given tattoos to patients since the 50s and 60s to set up patients. And I think that, as technology evolves, one of the nice things is to be able to go away from some of these things that, 10, 20, 30, 40 years ago, you needed tattoos because that was your only way of actually setting up the patient. There were no, image-guided platforms available on the machine to be able to verify somebody's setup on a daily basis. Now that we have both imaging, it really behooves the question, do we need to give permanent marks to patients? And I think the nice thing about surface-guided radiotherapy is that you can go away from that, particularly in breast cancer patients, where you really don't need to give patients tattoos, and you can treat them safely and reliably on a daily basis. And as you can imagine, as patients go through surgery and chemotherapy, by the time they get to radiation, the thought of another, a permanent mark that is a lifelong reminder of what they've had to go through can be devastating for some patients. And I am thrilled that we can go away from that.